Good morning, Dr. Willis and Dr. Santura.
Good morning, supervisors. Good morning, community. Thanks for this opportunity to provide a COVID-19 update. I want to start with...
Can you pull the mic a little closer? Thanks.
Yeah, thanks. And I...
You can do it.
Yes. I want to start by recognizing the person sitting next to me, Dr. Lisa Santora. As I return from a much-needed and valuable leave of a few weeks to focus on some personal family issues, to rebalance and reconnect with those closest to me after 2 years of really exclusive focus on pandemic response. You've had a chance to experience what I've known about Lisa for the 5-6 years we've been together, her incredible integrity, her commitment to equity, her brains and her heart, and her clarity. So thank you, Lisa. I'm honored to be sitting next to you, and I want to be clear that Lisa and I share a vision of health for this community, and we are aligned in our approach to every policy that we pursue. With that, I'd like my slides, please, Alvaro. We are at a 2-year anniversary, and I know this was focused on last week. We were, I think it was March 17th, where the first shelter-in-place policy was instituted in the nation. Marin was among the 6 jurisdictions across the Bay Area to be the first to take that action. This is a good opportunity for us to look back at the past 2 years. What we'll be focusing on now will be a retrospective view of evaluating our pandemic experience objectively in terms of our outcomes. I want to start by acknowledging that it is a challenge to describe performance or evaluate our success in the context of a pandemic, because at best our goal is limiting harm. Loss and sacrifice are universal and shared globally in this pandemic experience. So the best way to think about success is actually to measure it in relative terms. So what's going to follow is a series of comparisons to national, state, and regional experiences. And we'll be focusing on primarily 4 different domains: health impacts, economic impacts, educational impacts, and social impacts. Next slide, please. So with health impacts, we'll look at case rates, hospitalization rates, and death rates. These are our case rates in Marin County. We have the state of California, 21% of residents have been diagnosed with COVID-19 since the start of the pandemic. In Marin, that number is closer to 13%. So about 1 in 5 residents across the state, closer to 1 in 8 Marin County residents have been infected with COVID-19. Next slide, please. With regards to hospitalizations, Marin County Marin County residents have been hospitalized at less than half the rate of residents in the state of California. And what this slide shows is the blue line is our Marin County hospitalization rates. And what it really shows is that since the beginning of the pandemic, fewer Marin County residents were hospitalized, both pre and post-vaccine, which says a lot about the interventions that we took prior to the pharmaceutical interventions of vaccine in terms of social distancing, facial covering, and other non-pharmaceutical interventions as a community. Next slide, please. And then death rates, obviously, the most serious outcome, and what we are focusing primarily on is reducing risk of death. Marin County death rates, 108 per 100,000 residents. We've had a total of 275 deaths of Marin County residents. Obviously, each death is tragic, and we want to make sure that as we look at these numbers, we're recognizing these are not just numbers, but these are members of our community. These are our fathers, our mothers, our brothers, our sisters. But it's also important to recognize where we have relative success. We can see that our death rates are less than half of what they've been for the state of California and closer to a third of what they are nationally. Next slide, please. And then finally, one of our organizing principles all along has been equity. And what this shows is that when we look at case rates in our lowest income communities, we find that our case rates were actually among the lowest of any county in the Bay Area. And Bay Area actually fared better than other communities across the state and nation. So our focus on equity and our partnerships in low-income communities has translated into lower case counts in those communities. Next slide, please. One of the obvious reasons for any relative success with regards to cases, hospitalizations, and deaths has been our vaccination rates. This was data that was published last year, May 18th, 2021, and showed that of all the counties in the United States, over 3,000 counties, Marin County had the highest vaccination rates at that time. 81% of our population was fully vaccinated at that time. Next slide, please. And what we see is that we have slipped from number 1 to number 2 among those national, over 3,000 counties nationally in terms of the number who are fully vaccinated. There, surprisingly, Webb County, Texas, has higher vaccination rates. And it turns out that's a county right on the border of Mexico, and there's a lot of back and forth, and they've been really strong in their focus on equity and a Latinx focus, and they've been able to achieve very high vaccination rates in Webb County. And we are second highest, just over Cumberland County, Maine. Next slide, please. But when we look at the proportion of people across the United States who are both fully vaccinated and boosted, Marin County stands out as number 1, just over San Francisco County. And if you look at this list, what you see is the Bay Area really does stand out nationally as being the most highly vaccinated region in the United States. Marin is first, San Francisco second, Santa Clara third, and San Mateo fourth. Alameda County is also on that list. Next, and Contra Costa. Next slide, please. This is what vaccinations did for us in one of the most seriously impacted settings, which was our long-term care facilities. When the vaccines first arrived in mid-December of 2020, we were ready to go out to our long-term care facilities because that was a setting in which our death rates were highest, our case rates, we were having serious outbreaks in those settings, and obviously very vulnerable residents in those settings. We began on December 14th to administer first doses with an aggressive campaign across all long-term care facilities. The second doses started 3 to 4 weeks later, depending on the regimen. And through January, we were administering second doses. And what you see here is a dramatic drop in the number of cases in long-term care facilities immediately after those vaccines began to take hold immunologically for those residents. We were going from an average of about 50 to 60 cases per day to 0 to 3 cases per day. Next slide, please. And this, incidentally, was data that, because we had moved very early in this setting, we were able to use this data to share with the state and the nation in terms of the effectiveness of vaccine at preventing cases in long-term care facilities. Now, switching from health to economy. Hard to know exactly how to measure the economic impact. We thought one effective way to do that would be just to describe the number of weeks that we spent in the purple tier relative to other counties. If you remember the California Blueprint for a Safer Economy that started in August of 2020 and went through June of 2021, those 45 weeks or so where the state was under, every county was under the California Blueprint, which basically determined which sectors would be open, which businesses could be open based on the case rates. And what we found is that Marin County had among the lowest number, the fewest weeks in the most restrictive tier of any county in the United States, any county in the state. And that was because the formula for determining our tier was based on case rates and testing rates. And we had low case rates and high testing rates, which led to less restrictive policies for us as a county. So we were less restricted than other counties. Next slide, please. Moving from economic to, this is actually just to say more about the known economic impact. I think it's important to acknowledge that we know that lockdowns and restrictions did negatively impact the economy across a range of indicators. estimated $16 trillion cost in the U.S. This was a study that was published, the two studies cited there. But we also know that effective lockdowns did prevent infections and save lives. 1.7 million lives saved estimated. So the cost and the benefit. And our goal in Marin County as policymakers was to strive that balance between the benefits and the harms. Next slide, please. Moving to education, this was one of our, I think, most important priorities, and one of our most unique features as a county was how much we focused on trying to return school children to in-person education. In the 2021 school year, you might remember that many schools across the region simply were not open. In Marin, we actually moved to open schools as soon as we could. With a 30-point plan that Dr. Santora helped lead the development of the school safety plan that was implemented across all schools, public and private, in Marin County. By the end of the 2021 school year, we had almost 3 million accumulated student days combined in Marin County. That compares to close to 0 student days in some other jurisdictions. We recognize that every day a child was able to leave home, not have that remote learning experience, but to go to school and be socialized and be with others and be in person in classroom was value. And that was something we were able to achieve early on, as early as when schools started opening in the fall of 2020. And now we're, all schools were fully open to full-time classroom-based learning before the end of the 2021 school year. So we were the first county in the state to return students to in-person instruction, and we're recognized by the U.S. Department of Education as a model of integrated and collaboration and partnership between public health and the Marin County Office of Education, and that's something I want to acknowledge. The gratitude to Mary Jane Burke and her team for really walking with us at every step over the past 2 years. Next slide, please. And then finally, recognizing the value of social gatherings and mitigating the risk of isolation that comes from restrictions and lockdowns. Marin County led the social bubble movement in June 2020. If you remember, we were acknowledging that social gathering was an important part of quality of life. And along with Marin, Alameda, and Contra Costa, and San Francisco, the four of these 4 counties came together. And really, even before the state was necessarily formally approving these sorts of gatherings, we recognized that if people gathered together outdoors with 6 feet distancing and facial covering, they could do so safely. And that was because we recognized that health more holistically encompasses not just physical health, but also mental and social health and economic well-being. Next slide, please. So these are some of the factors that contribute to our success. These have been, I think, also emphasized in the retrospective view last week. First and most important has been the community behaviors. Our community members themselves. If there's any credit to be given, it really is a shared credit across all of us. The tools to prevent spread were optimized pre- and post-vaccine. So the stage had been set when the vaccine arrived. We had already had a track record of success on lower case rates and lower hospitalizations. So when the vaccine arrived, it was not a surprise to me that we were actually among the most receptive communities and had some of the highest vaccination rates all the way along. A shared understanding of our mutual responsibility to one another to control this pandemic. And then the positively reinforcing aspect of these behaviors, because what we saw was that when we do move together this way, we do see lower case counts, lower burden, and that reinforced that behavior over the past 2 years and ultimately allowed for fewer restrictions and more freedom. Our policies were another strength, and for our part, I think as public health, we've been focusing on a balanced response, looking at the science and the evidence, and focusing on equity. And then finally, not to diminish the importance of just clean operations and efficient operations and the hard work of the teams that have gone to make sure that testing is available, that vaccines are available, that contact tracing is happening, that the policies are clear and updated. And that was strong partnerships across all sectors: government, healthcare, schools, businesses, families, and community members. Next slide, please. So just to summarize, this retrospective view of some of our performance and some of our measurable outcomes, Marin residents have all experienced significant loss. Relative to the nation and state, we've also experienced fewer cases, hospitalizations, and deaths. We've had significantly higher vaccination rates, fewer business restrictions, and more days in school. And this is due to the collective impact of all communities and sectors coming together. And the lesson learned in our pandemic response will serve us well in future challenges, including potentially future surges within the pandemic and other issues outside of communicable diseases. Next slide, please. Thank you. That completes my presentation.
Dr. Willis, thank you very much. Nice to have you back on the scene, but also glad that you were able to take time off, and Dr. Santura gets the next bite of that vacation and time off apple, I hope. I really appreciate also just the retrospect and the looking back globally, and we talked a bit about this last week, but it's just, your leadership. And I think as a board, us making a decision early on to let the politics step back and let science step forward really served this community incredibly well. And folks across Marin stepped up and stepped forward and did put community first and acted individually to support the larger community and continue to do so. And I know we've all learned a lot, not just about a virus and a pandemic, but also about community. So it's been an important time, and there'll be a lot of positive lessons and silver linings that we carry forward